Hey, this is Chelsea Dunstan, and this is my Module 5 blog post on communication, motivation, delegation, and emotional intelligence. As far as communication goes, I think communication is beyond extremely important for leadership and managerial success. Having worked on a unit that had a really bad assistant director for so long, who was a very poor communicator, I've learned a lot from all of her mistakes. She would pick favorites, and she would tell some people some things and some people something totally different. So it's just very important to be very transparent with everybody. She would be one of those difficult people, and because of her difficultness, once we got our new director, she is no longer with us. One thing that I find that tends to give me the biggest hiccup with communication would be stress. Stress from work, stress from being in school, stress from being pregnant, hormonal stress. I find myself talking to patients and I lose my thought in no time, and that's not a good thing. So I need to make myself more aware of what I say, how I say it, when I say it, so that I get my message across without losing my train of thought. Communication is also very important in being a listener and not just being the talker. I have a really bad tendency to try to finish other people's sentences, so this has made me very aware that being an active listener, you sit there, you engage in the conversation, you actually listen to what that person is saying, and even if you have to repeat back what it is so that they know you're actually listening to them. There's a difference between hearing what somebody says and listening to what they have to say. And I think I am a very good listener, but I also think that I definitely have room to grow on that. As far as delegation, this post could not have come at a better time. My manager actually approached me today and asked what we were going to do when I go out on maternity leave at the end of October. The two surgeons were semi-freaking out today about what exactly is going to happen. Is somebody going to come in and replace me, fill in for my spot, and what exactly are we going to do? So it really kind of made me sit there and think about everything that I currently do as my position of coordinator of the joint replacement program, and who would be best suited to fill my shoes while I'm out for 10 weeks after I have my baby. So the questions that the delegation exercise ask, whether it's a task I must do myself, is it a vital task that must be done correctly, whether I like doing the task or not, if it actually needs to be done, and if I could really delegate this task. I think there is a lot of stuff that I do that I can delegate. I don't have to do everything. However, I look at my job and I look at everybody else around, at those who I can delegate these tasks to, and it's one of those, like, they have so much other stuff they have to get done. I just do it myself. I do it to save them time. I am a little bit OCD type A. So it is a matter of, is it going to be done correctly? Well, if I do it myself, I know it's going to be done the way I want it. And I guess I need to realize also that just because the way I want it done doesn't mean that's the only right way to do things. So this has just been a major wake-up call, because I've had to look at the other questions. Who among my team can take care of the elements of my job? Well, we looked through all the other nurses who take care of our joint replacement patients. Our top choice, unfortunately, is going to be leaving us in a couple weeks. My second top choice is one of our charge nurses as well, so we can't pull her off the floor as charge nurse for 10 weeks. So plan C is an excellent choice as well. So it was really hard to kind of narrow it down from who is available and has the knowledge and the skill and the leadership qualities who can fill my shoes while I'm out. What authority and preparation will this person selected need? She is a very quiet, soft-spoken nurse. So to deal with my two surgeons, you kind of have to come out of your shell a little bit. So I'm hoping we can convince her to do that. She thinks the surgeons don't love her, but they really do. They would put her on a pedestal if they could. And then how good of a job would the person do? I think this nurse would do an excellent job at filling my shoes while I'm out. I think she's afraid of everything that I do have to do. I'm sure if it came down to it, we could delegate some tasks to other people, but most of these tasks are things that I have taken on that they could delegate to me. So I hate to kind of give them back, although it is short term. Let's see. Delegation is definitely something I need to improve on. Like I said, I'm one of those who I would just assume do it myself to make sure it is done right and to take the stress off of other people. However, sometimes everything that I do have to do does stress me out. Floor experiences is something else that I have to look at. I have learned a lot in the last 6 years working on a med-surg floor. And delegating what I can do versus what I should have the CNA do. And it's just really hard sometimes when everybody is super busy trying to delegate. My biggest thing was during the morning med pass, when you're going in a room and a patient really needs to go to the bathroom. I don't mind getting them up to the bathroom, but when I have to walk out to pass meds to the next patient and the CNA's rolling their eyes at me for leaving the room, my biggest point to that CNA was, well, although you can't pass medicines, you can help them out of the bathroom while I finish passing medicines to the patient. And that's kind of given a little bit of an explanation as to why I'm delegating this task to her. They can't do my other jobs, but that is something they can do. That is in their scope of practice and is in their job title. Motivation. Motivation has been something that has been lacking in my unit. It is definitely improving. Some of the issues we've had with poor motivation of our nurses are the working conditions, poor management, a lot of people leaving, a high turnover rate, which led to overtime. Let's see. The relationships with peers. A lot of people come to work and they're there to be friends more so than nurses, and that is definitely a problem. And then there's issues with autonomy. That's definitely something else we need to work on with our nurses. But one thing as nurses we have to remember is our focus isn't on ourselves as nurses, it's on what we can do to help that patient. So as motivation, they need to look at all the patients they've helped, all the differences they've made in these people's lives. And that in of itself is excellent motivation to continue to do your job to the best of your ability on a daily basis. As much as I hate going to Walmart and the grocery store, one of my favorite things to do, even though sometimes I won't lie, I do avoid the patient so I'm not stuck talking to them for 20 minutes, is seeing previous patients up living a higher quality of life than they did before they had their hip or knee replaced. So that right there is motivation to me. Some things that they have changed on our unit to increase motivation was the change in management. We have a brand new director. She's been there about a year. That is finally holding everybody accountable for their actions. She is giving respect and rewards when due. I'm all for giving credit when it's deserved, and so is she. She gives praises, she gives thank you notes, she will let you know, hey, you were doing a great job today, so keep up the good work. And that's something that we haven't had in the past. We get rewards for documenting correctly. So much of our reimbursement has to do with how our nurses document, and we have something called a Documentation All-Stars for those who continuously document correctly month after month. They do praises. We have something called wow cards that the patients and other staff members can fill out. That helps motivate people when they know they've done a good job. And then acknowledgement. One thing that we have is called a scope, and it's a little newsletter that goes out to the whole hospital every week. So any nurse who has achieved their BSN or MSN or some sort of certification, they get credit and acknowledgement in that scope. And that's just something nice to see. All that hard work you put in to going back to school for whatever it may be is recognized. And that's not just our floor, that's our whole facility. So that's always nice to see. As far as emotional intelligence, self-awareness, that is something that I do need to be more aware with more for myself, especially here lately with my pregnancy hormones. Some days I'm on a high and some days I'm on a low, and every day is just a little bit different. So typically if I come in raging, it's not over anything in particular. It is because of my hormones. I know that's what it is. So there's my self-regulation, but I really don't know what to do except just kind of sit there, take some me time to cool off. Luckily, I haven't had as big of a problem with that at work as I have at home. I guess my body knows to hold it in, so I can keep my job. Social skills, I try to be a good communicator. I try to pay attention to social cues from other people, their facial expressions, their body language. Motivation, I do try to motivate all of our staff members. I let them know when they're doing a good job. I try to help them when they're having a hard time, and if they've had a hard day for whatever reason, I try to help talk them through that. As nurses, we're never going to have every day as a great day. Everybody's going to have a day here and there where they have a patient that goes bad, or they actually lose a patient, or whatever it may be, and that's just life. That comes with the territory. It comes with a job title. But it's just important to remember the hard work that everybody does, and let them know that they are doing a great job at what they're doing. And then empathy. It is very important to realize other people's opinions, how they feel about things, and acknowledge their opinions, their beliefs, their thoughts, without necessarily putting them down and saying they're wrong. I did take the quiz that was under the video with the different facial expressions, and I got a 13 out of 30, which was an average score of reading facial expressions. I was a little bit shocked. I thought some of them were a little bit difficult. I guess I need to practice focusing on people's body language a little bit better, but I guess it's one of those things where all the faces on the screen were strangers. You work with certain people long enough, you read their body language long enough, you figure them out pretty well. So you know when somebody's happy, they're sad, they're embarrassed, or whatnot. So emotional intelligence is definitely something I can grow on, as with everything else. Like I said, I've only been a nurse for about 6 years. I've been in my leadership position going on 3 after this year. So I definitely feel like I have some strengths, but I also have my weaknesses. I really have enjoyed this class. It has definitely helped me realize my strengths and weaknesses, and I can't wait to finish it and take even more away from it. Thank you.